Hello, and welcome to the third module in the series focusing on child and adolescent mental and behavioral health. This module will focus on available community resources. Unlike previous modules that were applicable to anyone, the community resources module will focus on services in the state of Illinois, more specifically services in the central Illinois area. So the first service that we're going to look at is SAS. So this stands for Screening and Support Services, and they perform pre-hospitalization psychiatric screenings on youth and adolescents that are having a mental or behavioral health crisis. So these could be children who are having suicidal thoughts or ideations, homicidal thoughts or ideations, or otherwise are presenting with aggression to the point that they may need psychiatric hospitalization. So a SAS screening both assesses them for the potential need for psychiatric hospitalization, but it also opens them up for eligibility for follow-up services. So this is follow-up therapy, follow-up medication management, things of that nature that they become eligible following the SAS screening. So SAS screenings serve those who would utilize public funds in the state of Illinois from either DCFS, DHS, or HFS. So this is any of the children that are on Medicaid or that have any of the Medicaid MCOs is the population that is served by the SAS program and would be eligible if they're in a mental or behavioral health crisis for a SAS screening and then subsequent follow-up services. So you would call SAS if you believe there is a child that needs to be psychiatrically hospitalized, and the eligible population served, as I said, is children under the age of 21 that have Medicaid or any of the Medicaid MCOs. And so the number for SAS is 1-800-345-9049. So the way SAS works is there is a centralized statewide phone number. It's called the CARES line, and that acts as the intake for the SAS program. And then there are individual agencies throughout the state that then contract with HFS to have the contract for SAS in that area. So in the Peoria area, that is going to be the Children's Home Association of Illinois in Peoria. Another thing to keep in mind with SAS is that it is community-based. So if you have a child that is presenting with a mental or behavioral health crisis and you're on the fence as to whether do they need psychiatric hospitalization, you can call SAS out to the site. So whether this be a summer camp, a school, in the home, you can call the CARES line and have the SAS agency respond to the location of the crisis. Or if you feel that there is a safety risk, the child is a danger to themselves or others, or the environment just would not be conducive to having a screening done on site, the child can be transported to the emergency room at any of the local hospitals, and the screening could then take place there if needed. Another service we will look at is ERS, or Emergency Response Services. In some areas of the state, this is also known as RR, Rapid Response. And these services provide assessment and referral services for those experiencing a mental health crisis. So in the central Illinois area, we have ERS, which is Emergency Response Services. In the Springfield area, through Memorial Hospital, it is their service is referred to as Rapid Response, but generally they are all very similar and they do the same things. So they are oftentimes the first point of contact when someone is experiencing a mental health crisis. ERS will respond on site to do kind of a initial assessment. If they feel that someone needs to be psychiatrically hospitalized or they need some sort of inpatient treatment, can do the referral and transport for that. They also can just be there if someone needs someone to talk to help talk them through the crisis that they're going through. ERS is also a great resource for that. But they offer assessment and referral services for those that are in crisis. So, when to call them if you or anyone else is having or experiencing a mental or behavioral health crisis. And they will serve anyone in the service area. So they are not strictly limited to Medicaid recipients or any specialized or specific population such as that. In the central Illinois area, the ERS numbers for Pekin is 309-347-1148. The Peoria area is 309-671-8084. And there are similar services such as these located throughout the state of Illinois. Oftentimes they're provided by local social service agencies or through hospital systems, such as in Springfield is Memorial Behavioral Health. The Pekin, East Peoria area is Tazwood Center for Wellness, and the Peoria area is run through the Human Service Center. Another great resource that we're going to look at today is called 211. So this is a service operated by the United Way, and it is a nationwide confidential referral and information service to connect callers to information and services. So they are kind of a centralized information and referral system. So they have information from everything from homeless shelters to local food pantries to therapy providers to LIHEAP and energy assistance. They kind of are a one-stop shop for everything social service information related. So when to call them is if you or anyone else is in need of social services. They act as a good first point of contact when you're not quite sure what service you are looking for or not quite sure what providers are in your area. So if you have a child that is experiencing a mental or behavioral health crisis, they don't necessarily meet the eligibility to be SAS screened, or they are ineligible for such follow-up services, calling 211 could be a good step in finding local therapy providers that might take their insurance or whatever services that child is in need of. Eligible population served, so this is anyone in need of services. So there is no specific population served. They will serve anyone that is in need. And what is the number is 211. If for some reason the 211 system does not work with your phone, the local number for the Heart of Illinois 211 provider is 309-999-4029. And that concludes the module on community resources. This module was shorter than the others, but I hope that it was still very informative and is able to assist you in helping those that you work with if they are experiencing a mental or behavioral health crisis. And this is the final module in the series on child and adolescent mental and behavioral health. Thank you for joining us.